For over 30 years, Marg Bowser has dedicated her life to serving the healthcare needs of our community. She brings an amazing, positive energy to her role as a registered practical nurse on rehabilitation and carries out her work with genuine enthusiasm. She is trusted by her colleagues and demonstrates the excellent communication needed to provide exceptional nursing care for her patients. Patients and families are thankful for the outstanding care Marg provides, exemplified through the many thank you cards and letters she receives. Marg encourages patients to rehabilitate back to their optimum physical best when they have suffered from a debilitating stroke. She places high value on the nursing profession and nurses each patient with excellence. She goes that extra mile to provide dignity and caring, and she genuinely believes laughter can be some of life's best medicine. Each and every day, Marg listens respectfully so she can plan her care and implement it with the utmost knowledge and safety. Marg updates her nursing skills, attends seminars, and volunteers on a number of committees, and is always eager to share information, ideas, and new learning with her colleagues. Marg recently took the initiative to accept mentorship for a consolidating new graduate nursing student. The student described the experience as exceptional and said Marg's honor, integrity, and excellence inspired her to be the best nurse she could be. When Marg is at work, her colleagues are confident that whatever the day may bring, they will work together as a team and will provide exceptional nursing care each and every time. As Director of Diagnostic Services, Debbie Croteau's leadership skills shine as she builds relationships with staff and promotes harmonious interactions within the department. Debbie values her staff and inspires them to be their very best. She makes a point of understanding each staff member individually and looks for new ways to help them reach their potential. She is eager to celebrate their accomplishment, whether work-related or personal. Debbie engages staff through regular meetings where the team receives departmental and organizational updates and addresses improvement opportunities and cost-saving ideas. Debbie has been a champion for implementing the performance and transformation system tools within her department, touting 100 process improvements implemented in the last 6 months of 2013. Debbie also promotes continuing education and regularly offers staff the opportunity to take part in teleconferences, webinars, and online courses. Debbie recently led the implementation of new glucose meters across the hospital. She worked with Transform, the vendor, the lab, and nursing to get this project up and running on time, working extra hours as the go-live date approached to ensure the project would be successful. Debbie's attitude towards work and life is infectious. Her positive personality can calm the wildest of seas, and she believes in wellness for both the body and mind, encouraging staff to stay active and enjoy life. Melanie Halliday volunteers with recreation therapy programs on cognitively complex care 3 times per week. She is regularly called upon to assist with activities outside her regular duties and to provide extra volunteer hours when needed. Melanie is a great resource for new volunteers and students who join the recreation therapy department, helping new volunteers feel comfortable in their role and providing assistance and support. Melanie demonstrates a great deal of compassion and is very sensitive to the needs of our patients. She shares her personal experiences when trying to assist patients in a leisure program. This allows the patient to feel comfortable and promotes a trusting relationship. Melanie consistently respects the patient's needs and wishes. Sometimes a patient will not feel comfortable in their ability to participate in a particular program. Melanie will reassure the patient, encourage them to participate in a more passive role, or say that the patient is coming to supervise the activity. Her ability to engage patients to join in meaningful social interactions helps them to have positive experiences in the leisure programs. Melanie is a strong support for the families of patients admitted to Bluewater Health. She helps families adjust to the many changes associated with their family members' hospitalization. One way she promotes patient and family-centered care is by encouraging patients and families to participate in leisure programs with their loved one. This helps create a positive experience for families when they come to visit and a more meaningful time for patients. Dr. Renato Pasqualucci is an emergency physician and medical director of the emergency department in Sarnia. As a physician and member of the professional staff, his moral and ethical standards of practice are high, and he is well respected by medical and nursing staff and administrative colleagues. Dr. Pasqualucci is compassionate in his interactions with patients and families, demonstrating genuine concern, kindness, and caring. He uses his extraordinary medical knowledge and technical skills to solve problems. He is a mentor and role model who cares deeply about the health and welfare of the people of Lambton County. Renato has taken the leadership role in implementing measures to improve patient outcomes, such as reducing wait times in the emergency department, improving patient flow, and reducing door-to-needle time in acute myocardial infarction and stroke. Dr. Pasqualucci participates in a number of committees, including the Medical Advisory Committee and the Quality and Utilization Committee of the board. He is a lifelong student and an excellent teacher. He is always reading and learning new skills and loves to share his knowledge with others. As an example, Dr. Pasqualucci co-organized a course for ultrasound-guided venous access and has held a number of successful emergency conferences in the past. For his colleagues, Dr. Pasqualucci has contributed significantly in making Bluewater Health a better place to work and for his patients a better place to receive care. Psychiatrist Dr. Dave Robinson is patient-centered, evidence-based, and committed to elevating the delivery of care throughout the mental health program and our community. His interactions with patients, families, and colleagues are consistently respectful, and he works without fail to provide quality and care in which he engages patients and families with honesty, integrity, and clarity. In many situations, patients and families may have had difficulty coping, either because of circumstance, diagnosis, or treatment. Dr. Robinson's demeanor has always remained respectful and courteous to patients and families in crisis. For example, Dr. Robinson agreed to accept care for a complex and challenging case. The experience involved heavy criticism, considerable challenge, and complex issues ranging from safety, housing, and ongoing conflict. With the patient at the center of Dr. Robinson's work, he advocated for the patient to be heard in treatment planning sessions, and, despite an evolving plan, the patient made their own choices, which were respected. Dr. Robinson not only maintains knowledge of evidence-based practice, but shares this in the context of his day-to-day interactions with nursing, social work, and other members of the healthcare team. He is a lifelong practitioner, author, presenter, and educator, and has volunteered his personal time over many hours to prepare and instruct a training program to expand the knowledge of the specialized nursing team in mental health. This extraordinary contribution is making a positive difference in optimizing the scope, role, and function of the team. Helen Shaw, Manager of Infection Control, is always searching out and reviewing the latest journals, articles, and data on patient safety and looking at how we can safely and effectively implement these practices into our policies and daily work. She uses fact-based research and believes in and supports Bluewater Health's patient safety policies and procedures. As a key player and believer in creating the influenza protection policy, Helen strives to educate and inform staff about the evidence and data that supports it. She goes out of her way to have conversations with patients and families about any infection control concern brought forward. In each interaction, she is respectful and helpful. Within her department, Helen builds up her team and is a patient and courteous leader, recognizing her staff's work and always making them feel appreciated. In her role, Helen works directly with leaders of units and departments to advance patient safety practices. Because she is such a trusted and reliable source, managers and frontline staff members often contact her for advice. She always makes time for concerns or issues brought up by any member of the Bluewater Health team and will meet directly with staff in person to address their questions or concerns. Outside the hospital, Helen connects with community partners such as Public Health, the Sarnia-Lambton Infection Control Committee, and the Regional Infection Control Network. She is a trusted committee member who is always willing to participate in discussions and act as a resource for other facilities.